Welcome, Professor Daube. Some people are thinking that the job on smoking's done. What's your view on that?
One of the great myths is that we've solved tobacco. We haven't solved tobacco. It's still a massive problem. It kills 6 million people a year globally. It's going to be responsible for 1 billion deaths this generation. And we now know that up to 2/3 of Australians who smoke are going to die because of their smoking. So it's still our largest preventable cause of death and disease, and it would be just catastrophic if we backed off from action because of complacency. What we've got to do is to step up the action. We know what needs to be done. Let's get it done. Time to be complacent when there's nobody left smoking.
What are the most effective strategies?
Again, we know what needs to be done. We know that we need a comprehensive approach. There's never one magic bullet. It's a comprehensive approach which comprises tax, keeping the prices high and increasing them, strong mass media campaigns, protecting kids and other non-smokers from passive smoking, and a raft of other measures, things like plain packaging, strong warnings, and of course focusing on disadvantaged groups where the problem's still at its greatest. But one thing we have to keep emphasising is a comprehensive approach, because if we just go for one magic bullet here or there, we'll fail. If we go for a comprehensive approach, we'll continue to lead the world.
Some disadvantaged groups in the community have still got a high prevalence of smoking. Do we need to do different things for those groups?
We need to do the same things that we do for the overall community, because they are what is having an impact even on those disadvantaged groups, and we need special activities, special programs for disadvantaged groups. So, price is important for disadvantaged groups, extra important. So are mass media campaigns, so is protecting kids from passive smoking. But we also know that we need special and well-funded programs for Aboriginal communities, Aboriginal people. What we need for people with mental health problems who smoke more than 40% of the cigarettes smoked in Australia today is we need a major effort that includes our colleagues in the mental health system. You know, the life expectancy of people with mental health problems in Australia now is 14 years less than it is for people without mental health problems. Tobacco is a huge contributor to that. And that's why we need to work with people in the mental health system, so they are helping us to be part of the solution for people with mental health problems.
How do you think we can communicate the magnitude of this issue to our current crop of politicians?
One of the things we've learned over the years with tobacco is there are always new ways of getting across the magnitude of the problem. You know, more than 40 years ago, a journalist told me you'll never find anything new to say about smoking. And we've been finding new ways of communicating the magnitude of the problem over and over again. I think one of the things that we've lost is the impact that comes from media coverage about new evidence on the extent of the problem. So we have to keep finding new ways of doing that. We need to communicate to politicians that it's not just a big problem at the global or at the national level, it's their constituents who are dying because they smoked. There was a while ago when a card went from GPs to members of parliament every time a patient of theirs died because they smoked. So I think we need to get across the big picture, but we also need to personalise for politicians. It's their constituents who are dying needlessly. It's their constituents and their families who are suffering because they smoked, and we've just got to keep working away at it, keep producing the evidence, keep being creative about getting it across.